Welcome to Future Sense Now, where we explore the landscape and byways of our shared futures. An e-zine of the Futures Forum live online. We exchange ideas, information, and inspiration about the futures we want. Get Future Sense Now with host Dr. Claire Nelson, futurist and editor of Human Futures.
Greetings and welcome to Future Sense Now, an online e-magazine of the Futures Forum. We're live online. It's April 7th, it's World Health Day, and we are in the middle of the worst global crisis that we have seen in my lifetime. A 100-year occurrence, as they would call it. So we want to talk about healthcare futures in Africa and the Caribbean and Pacific, in developing countries in general. And I'm doing this because I think despite the crisis we're in, we must continue our forward march towards health for all by the year 2030. Yes, SDG 3, Sustainable Development Goal number 3, focuses on health for all, and it talks about ensuring healthy lives. And these targets for SDG 3 can touch on everything from universal health coverage to tobacco control, to reducing number of deaths due to road traffic accidents, substance abuse, and of course the chronic and critical illnesses that we all endure. Better quality, better access, more patient-centered, whatever it takes to have great health outcomes. Now, one of the critical aspects of achieving good health outcome is access to labs. Yes, without those tests, where would we be? So I'm delighted to have with me today Dr. CHESIE VOMA, who is from Cameroon and who is a clinical pathologist here in Atlanta, Georgia, USA. She's the founder of a startup, yes, called Lab to Doctors Express. And we're going to have a great conversation about how she thinks about what is happening and how her startup might not only deal with our current crisis, but more importantly, address the issue of accessibility to labs in Africa where she's from. So welcome, Dr. CHESIE VOMA. How are you?
Good, Dr. Claire. Thanks for the kind introduction. I'm doing good.
You're doing good. Great. So tell us, first of all, tell us a bit more about Lab to Doctors Express. It sounds like an exciting idea. What is it exactly?
It's exactly about being able to meet the patients where they are, to collect quality samples from them and facilitate the testing of these samples without them leaving their homes. That way we ensure the quality of the samples collected and that we enable them to make the most use of their time, avoiding long wait lines at the hospital or avoiding or interrupting other daily activities that they may have at the same time, being able to give their health the attention it deserves.
You know, did you start this up before the crisis by any chance? Was this started before the crisis?
Yes, this was started before the crisis because I had seen the direction that healthcare was taking, or not just healthcare, but services in general. It was about meet the clients, meet the customers. And so it was in this regard that I being in the healthcare industry, I said, how can we make it more efficient to meet the patient? And I thought the best way to meet the patient for lab testing was to go get the samples from them.
So you're talking about patients. I know for sure one of the critical groups of patients here in the US is certainly those who are the elderly, they shut in. I mean, we have an aging population. And of course, now we have COVID-19. Do you believe that you're just starting up, just getting your client base, etc., but do you believe that this crisis will actually accelerate the progress that you have made so far?
Yeah, I think that in the face of this crisis, with the progress I've made so far, I would be able to use my services to facilitate testing, because we are talking about social distancing. You can keep every sick person apart, but as long as you don't identify them to treat them, trust me, it would keep on multiplying and going on. The only way to stop it after after putting social distancing into effect, we also have to go about testing these people, identifying the infected people and treating them. That's the only way to stop it.
So let me ask you a question. We're thinking about testing. Have you, in your current, job, come across the test process for COVID-19 now? Not other things we'll talk about later, but for COVID-19, have you come across the tests? I don't know much about the cost of these tests. Is this, knowing what you know about disadvantaged populations here in America, right? So we're talking about servicing also poor people here in America, and then translating that back to Africa, which is one of your passion areas. What do you think needs to happen to really make these tests affordable and accessible to more people?
Based on the way I see us handling the crisis here in the U.S., especially with the rural areas or the areas that are not really financially affluent, I believe that the way to address or take care of a situation like this in Africa would be to come up with point-of-care testing devices, handheld devices, because that way we don't have to. We'll be able to meet the patients and test them at the point where we need them to be able to say you're infected or not. Right now in the US, they have to collect samples. If you call that you're sick, they'll tell you to stay in your house. If you're within a certain age, we are giving priority to the senior citizens, to the elderly. Yet you have younger people who are sick and they're out there in the community. We cannot give them the attention now because of what it takes to get the samples to the lab to get them tested. Mm-hmm. Those facilities are not there. We have a commercial lab here in the US called CHESIE Diagnostics. Currently, they have 23 planes flying just to collect samples and facilitate transportation of these samples all the way to their headquarters in North Carolina. What would happen in the US? What company owns 23 planes? CHESIE Diagnostics owns it, and that's what they're doing. We cannot afford that in Africa. So how about we come up with these devices that would meet the patients and test them and be able to say you are infected and initiate treatment or take the next steps that we need to take.
Well, it's not just Africa. It's certainly where I'm from in the Caribbean and other small island states in Pacific, as well as in Africa, the Indian Ocean, Atlantic Ocean, a lot of small island states. And even here in America, we have lots of small islands, off the coast of Maine, in the Caribbean region, in the west coast of America as well. When you say point of care tests, I think I read somewhere that one of the labs had actually come up with a more fast test, but that's also not a point of care test, right?
It is point of care test, but the way the FDA is validating this test at this point in time because of the emergency, it's not the same validation processes that same test would undergo without this emergency. So normally we will call them wave tests, and there's a different procedure altogether to have that test validated. Right now, because of the emergency, just about whatever has some amount of sensitivity is acceptable and put out there in the market and put into use. But then they still have a higher rate of false negative results, meaning that they are not addressing the situation.
Okay, so give me some background. You are a clinical pathologist. What exactly is your specialization?
My specialization is on clinical chemistry and microbiology, coagulation, hematology. So everything that can be tested from liquid, from blood, any liquid from the body is what I can test. Is it your spinal fluid? Is it your sputum? Is it blood? Is it your sweat? Every liquid from your body is what I'm specialized in testing.
So what are you thinking from the African context now? Based on where the technology is and what we have in Africa, the Caribbean, the conditions on the ground. What are you seeing as you think about 2030 and you think about getting to that point and the crisis that we are in, but we have to survive this crisis, right? Do you think that in the next 6 months to 9 months, we have the technology to actually, if we had the will, to put together devices or kits with additional devices that could be dispatched in large quantities to Africa to do this kind of testing?
Yes, so we are, the goal is to use what we are, the survival skills now, to be able to project it and say, how can we make this work in Africa?
Yes.
Most of these point of care testing devices already exist. All you need to do is to say, what is your target? If my target is malaria, all I need to do is to be able to identify the genes specific to malaria and put on that same platform. And then I'll be able to test for malaria based on the specific gene targets on that platform. So these are existing platforms. All we need to do is to be able to say, this is a prototype. I want to use it at this time to test for cholera. I want to use it at this time to test for malaria. I want to use it at this time to test for any other infectious diseases that are affecting the people.
So let me ask you a question, because I'm not in healthcare. I'm an engineer, not a healthcare expert. So let's say, for example, you might know that, as you say, there are tests already fairly well available in Africa for malaria or HIV, AIDS, like the spit test and all of these things that already exist. Are you saying that if we were able to rapidly identify a gene or a part of a gene, I guess a virus is not a full gene, it's a half a gene or something. So are we able to use what we learned with the HIV crisis, for example, to borrow from that to quickly identify what is testable, quote unquote, in the COVID-19 virus, and then put that on some platform and roll it out in the space of 9 months if we had to? Do you think that already exists?
If we have the resources, just like I'm currently talking with companies that are specialized in point of care testing devices, if we have the resources, within a 9-month period, we can definitely come up with platforms, handheld devices, affordable, that would use less reagents and still be able to give quality results in a shorter time.
Wow, that's very impressive. I mean, you speak with a lot of conviction. So
yeah,
I really hope that this conversation for me is not just a conversation for the sake of having a conversation. I mean, I was really happy to come across you online and to reach out to you and to have you reach back, because for me, this is really one of the passions around, you know, the vision of healthcare for all, and knowing that the average person, let's say, whether it's Jamaica or, you know, Guyana or Ghana or Zambia, you talk about people who are earning, let's say, call it $50 US, you know, a week, if we're lucky, right?
Yeah.
This is now middle class people. I'm not talking about poor people. Middle class people in these countries earn $50 US a week, right? And from this basket, they now have to do a test. So the test really cannot become more than $5. Am I making sense? So I know the government will have to subsidize it, but for people who can't even afford a subsidized kit, then when you look at what, let's say, the different healthcare foundation, Bill Gates Foundation or the other foundations, World Health Organization, or the World Bank, let's say, reverting a loan from building hospital to now doing testing, are you saying that you really could, if you had a funding, you could put together these pieces and become part of a, I call it a strike force then, to lead this forward? Because I think we need people like you to be heard and to be seen, because we, I just say, we're in a crisis. How can you help me understand so we can help you get your voice out there, basically?
So basically, the first thing is I've already acquired the knowledge and the skills I need to be able to put this together. All I need now is like financial support, access to companies that already do things like this, that already come up, that already have this point of care testing platforms, and indicate my interest to them, to be able to have these platforms test and and monitor infectious diseases that are affecting Africans or people in other regions. That way, with the financial support, with the access to these companies, we will be able to identify the genes of whatever targets we are interested in, and apply to the nitrocellulose. Most of them have like nitrocellulose strips in it, because you could either do it as a PCR or an antibody, depending on what you're trying to do. Those are the two different ways. And with the resources, you'll be able to put all of this together on platforms that already exist. The methodology is the same thing. All you're doing is saying, I don't want A. Right now, I want to test B. Take A out of it and put B on it, and be able to test it until you can prove that 90% of the time, I'll be able to get the right result every time I put the right sample on the device.
What is fascinating is that you're talking about the cost being very much different. So perhaps if we look at COVID-19 as sort of a opportunity, it's a crisis, yes, people are dying, but for a long time I've been talking about access to healthcare in Africa. What are some of the institutional changes you think would have to happen to actually get you through the door on the ground? So let's say you have the content, but what are some of the institutional changes that have to happen on the ground in Cameroon, in Nigeria, in Senegal, to basically have this work seamlessly? We don't want to have you over here raising funds, but nobody down there is moving forward with you. How do you see that partnership and collaboration between yourself as a member of the African diaspora and the healthcare professionals and healthcare community where you're from, partnering to make this viable?
So already I'm in communication with professors, researchers back home in Cameroon, where I come from. I am in communication with medical doctors in at least 5 different cities. And these are people who are equally passionate and interested in the drive to be able to make healthcare affordable, accessible to all, and improve the standards of living. I can simply work with them, put up a plan with goals on what to achieve during different periods, and be able to get these projects going while collaborating with them in Africa.
Yeah. So beyond the COVID-19, what else do you see as a priority moving forward?
Personally, moving forward, when it comes to Africa, I see malaria as a priority. Because I know currently the way we test for malaria, if we could, malaria as in relation to children, in relation to pregnant women, it can be so devastating. If we could come up with easy handheld devices that people can even afford and keep to themselves and be able to test themselves just like you test your blood sugar, to be able to know to know that you are infected. Then you know exactly to begin treatment without waiting to see the doctor. Sometimes people will not go see the doctor because they don't even have the money to pay for consultation. But if you can afford this device, then you have it for good, and you can always just know how to maintain it. They're usually very easy to maintain. You know, you don't need the biggest handbook to be able to maintain a handheld device. So it's kind of empowering people to be able to monitor their health and know when to take treatment, when they should really see the doctor. Like I said, sometimes people get sick, and just because it costs this much to go see a doctor to consult, you know, you have to consult, then after you have to pay for your lab test. You know, if you know that you could prick yourself and put a drop of blood on a device and be able to know that I'm infected, then you know exactly where to go from there, right? Can you imagine a pregnant woman being anemic, what it means in Africa where malaria is so prevalent? Yeah. Those are some of the things that I'm thinking about, like how do we help them?
Yeah, lab to doctors express. So when you think about 2013, you think about where you are now, and you think about the passion, and you think about the connections you already made and the connections you are planning to make this year. where do you see Lab to Doctors Express in 2030 in terms of the Sustainable Development Goals?
So by 2030, I am currently Lab to Doctors Express simply meets the patients, meets the customers, meets the communities in the convenience and comfort of their homes, collect samples. Come 2030, I see us actually being the ones testing the samples that we collect. Now I'm creating the convenience. Now I am the bridge between the patient and the lab. Come 2030, by then I should have actually had a lab that is ready to test all of the samples that I collect. And the goal would be to be able to ensure the quality of your results from sample collection to your results. And that way you have no doubt, I can assure you that because my qualified phlebotomist collected your sample and I'm fully aware of the performance level of my instruments, I can tell you that I have been able to monitor the entire testing process to give you quality results at any time.
Wow. So when you think about this, what are the top 3 things, I want to hear you say it again, that will enable you to get from here to there?
The top 3 things that should be able to help me get to my destination: access to manufacturing companies that currently manufacture these devices, some financial support that should be able to help me fund this, and together with increasing my network of researchers, of scientists in Africa that would work with me to be able to get these devices to actually test what I intend for them to test.
Wow, I really am hopeful that we can certainly help to get your voice amplified, get the Labs to Doctors Express, not only US, but Labs to Doctors Express Africa in play and successfully doing its own labs. As you say rightly, labs have been a very much a big piece of the puzzle in the African and Caribbean and Pacific small island developing country challenges in terms of making healthcare accessible. And we're just really excited that, even though we're worried about what's happening right now, we can use our, intelligence and innovation of what you're doing to help us have hope that we can get through this and get this. So thank you so much, Dr. CHESIE VOMA from Cameroon. Again, you are a clinical pathologist and with a several, doctor, what was your doctoral research in?
It was my PhD was in bioanalytical and clinical chemistry, and I did a residency in clinical pathology.
Right, and what was the actual dissertation title? I like to hear these things.
Okay, my dissertation was on the effect on low magnesium in the onset of diabetes and obesity.
Right. So you see, this person, she knows what she's talking about. So she has done the work and she's not just talking top of her head. She knows she can do it. And so I'm just really delighted to amplify your voice, Dr. VOMA, and hopefully help you get to where you need to go to get this done. So thank you so much for joining me on Future Sense Now. Yeah.
Thank you, Dr. Claire. Thanks for your time. And I'll definitely be happy and grateful to see other people join me in my passion and to be able to help us deliver the results to Africa and the world at large.
Yeah, that's it, folks. You've heard from her. I gave her the last word. Thank you for joining us on Future Sense Now, the Futures Forum live online, where we explore salient ideas for sustainable futures. Remember, the future is embedded in the landscape of today, so seize the future. We create the future we want. We can create the future we want. And so until next time, safe journeys. And we say in Jamaica, walk good.
Thank you for listening to Future Sense Now with Dr. Claire Nelson. Future Sense Now is produced by the Futures Forum in Washington, D.C. For more information, visit www.thefuturesforum.org. Remember, our futures are embedded in the landscape of our present stories. Seize the day, share this story, and share the future.